Welcome to the Health and Wealth Power Hour with industry expert and health insurance broker pro, Harlan Pickett. And now, here's your host, Harlan Pickett.
And welcome aboard, Harlan Pickett, Health and Wealth Power Hour. Great to have you with us today. Boy, we got a good one for you today. If you've ever wanted to hear a true story of the American dream, today you're going to get to hear it. You're going to get to hear about somebody who, as a child, wanted to be in America, and in particular in San Antonio, Texas, and did all the things that it took to make that dream come true and did it in the right way. Time for our first break. When we come back, the American dream. Harlan Pickett, Health and Wealth Power Hour. We'll be right back. And we are back. Harlan Pickett, Health and Wealth Power Hour. Thanks for being with us today. We are truly blessed and honored to have a good friend of mine, Shankar Ponsalé, with us today. About 4 years ago now, I met Shankar, and we were just happened to be at an event together. Shankar was is originally from Luxembourg.
Yes.
And we hit it off not just because he was from Luxembourg, but because right away we had this connection about a very interesting situation, a very interesting topic, and that is direct primary care. And coming from a country that has a totally different way of doing healthcare business than America,
yes,
you were very intrigued with direct primary care because it reminded you more of home, as it were. But first, before we get there, I really want you to tell us your American dream story, because that it always resonated with me. You had the opportunity as a teenager, right, to visit San Antonio, Texas. Is that right?
That's correct.
Tell us all about that.
Yeah, so it's a pleasure to be on the show here with you, and really is also a great opportunity for me to tell literally Texas and the United States about my love for the United States and for this state. I belong to probably the last generation that was raised by people who had directly been involved in World War II, right? So my grandparents and people of that generation, they knew what it was like to be liberated by the U.S. forces in Europe. So we just had this amazing admiration as kids for the U.S. and there had always been a huge attraction that I felt deep in my heart towards the U.S. even before knowing what this country is about and who you guys really are, right? So it's actually funny. Not too far away from where I lived as a kid, there was a memorial called the Mardasan. And it actually, if you have ever watched Band of Brothers, part of that takes place in Bastogne, which is not far from the Mardasan. And it's basically a huge memorial in the shape of a star. And then on the different sides of the stars, you have the names of the states inscribed. And I would go there on a regular basis to meet American tourists who would tour Europe and visit. So I just knew that there was something, and I had to find out whether that country was truly as amazing as I thought it would be. So for me, as a young individual, I felt that there was a need to go on a vision quest, if you will. So I told my mother, listen, I want to check out the United States, but if possible, I want to do it on my own, so that I can have like this true experience without any influence from the mother's side. And she was understanding, and she had a friend who at that time lived in Houston, Texas, and she said, if she's willing to host you, then that's fine for me. That person agreed to doing that, and I got the pleasure of in random summer jobs as a as a young boy to earn the money for the ticket to come to Houston. So at the age of 16, I came, and I remember the person that hosted me was a professional, so she was busy doing her thing, and in the mornings I would volunteer as at a YMCA in Houston in the Galleria area called the Post Oak YMCA. I don't know if it still exists, but that was really nice because one of the first experiences I got was how important volunteering is in the United States, right? And how that lets you tap into meeting others and also being seen as one of you, right? That was really, really nice. So one weekend, the lady said, well, I'm going to take you on a road trip to San Antonio. So we did that, and she must have parked close to the Alamo, I think. And my first memory of San Antonio was a bunch of United States Marines that had chairs set up in front of the Alamo, and there was some sort of commemoration. I don't know exactly what it was, but it's just, you have these defining moments in your childhood that just really literally define the rest of your life. And this was one moment like that. I stood there, I saw the Marines, I saw the Alamo, I saw this city that was American but also somehow felt Mexican, which I really liked. I remember the heat, I remember the smells of good food, and I told myself as a 16-year-old back then, one day I think you will make this city your home. I knew it back then, deep in my heart, and it's really funny. It's a funny story, but we're here to tell stories, right? So inside of the Alamo complex, there was a gift shop for tourists, and they sold a Texan passport, which really doesn't really exist, right? But I went inside and I bought that passport, and I had my photo stapled in, and I made the clerk that sold the passport sign it, right? Her name, we'll never forget it, Kelly Mitchell was her name. Kelly was probably a student too at that time, but to me she was the first ambassador of Texas.
There you
right?
go, yeah.
Yeah, so I mean, fast forward, I had the extreme chance in life to have a plan as a 16-year-old, a goal that I didn't move away from. I knew that one day I was going to come to this country, to this state, and do something very important. And because of that clarity in my mind, I was able to prepare for whenever that time came, because back then my English wasn't very good. I didn't have any legal status to be here in the United States other than a tourist. So I knew a few things. I knew that I would have to be a good student of the English language, and I knew that I would have to always put some money on the side for whenever the immigration came. I knew that was going to be an important transition in my life. And I knew that I would have to create a lifestyle as a young adult that would not cause myself to be bound to Luxembourg, right? So the way how you can legally get a green card, there are several ways. You can marry. The way best, you can be a great sports athlete. You can be a great scientist, and all of these things. You can't always control that as precisely as you want. But there's also the so-called lottery, which literally is a lottery where you participate each year, and when your name is drawn, then of course you have to meet certain criteria. Not all countries are eligible, by the way. But since Luxembourg is actually a very small and well-to-do country, so most people want to actually go there and stay there, not so much leave.
Not leave, right?
So maybe that helped a little bit, right? But it did take me 4 years of participating in that lottery. So once your name gets drawn, you have to undergo an investigation that is, in my case, was conducted in collaboration with the with the American Embassy in Luxembourg and the one in Brussels. And you have to show that you have a minimum of schooling. So you got to have a high school diploma. That's the absolute minimum. And you have to show that you have a good health, that you have a clean criminal record, and that also when you go into the interview with the ambassador, you have to have a plan that is other than, well, I don't know, I'm going to go there and see what
happens.
What falls in my lap. That's not going to work, right? So that, and also you have to show financial means so that you don't arrive and immediately become a public burden to the system. So after going through that procedure, I was awarded the green card. That must have been in 2010 when I actually physically got the card. And then you pretty quickly have to make up your mind whether you're really going to do it or not, because it's not meant to be a privileged tourist visa, right? You have to really be sure that you want to do it. And luckily I was in a situation where I I was working as a law enforcement officer for the Luxembourg government, and I could take a long sabbatical with the intention. You have to indicate your first intention, and for me that was pursuing studies in the United States. So there's a campus in Luxembourg by a university that is located in Oxford, Ohio, Miami University, and they had a campus in Luxembourg where most American students would go to fulfill their international requirement, and I was able to do it the other way, so that was very nice.
That's really interesting. And when we get back from the break, I want you to point out something there that I think is one of the biggest keys that I took away from when we first met, and that is while you were waiting, you had like a 4-year period of time where you were waiting. You didn't just sit on your hands. You did something very important for the country you were in right then. Harlan Pickett, Health and Wealth Power. We'll be right back. And we are back. Harlan Pickett, Health and Wealth Power Hour. Thank you so much for joining us today. We are privileged to have with us Mr. Shankar Poncelet. He is the CEO of ShankX, but not too long ago, he was a police officer for Luxembourg.
Absolutely.
Because whenever he was in the lottery that he mentioned earlier to have the opportunity to get a green card to come to the United States the right way, because he went through all the process the right way, he didn't just sit back and cross his fingers and hope and become a burden on a different government while he tried to get here. He was part of the solution for folks that may not be going the right path. Mm-hmm. And so you had a shorter career in law enforcement, but you didn't know how long it was going to be because you didn't know for sure that your American dream was even going to be possible.
That's correct.
But tell us a little bit about why you went into law enforcement then, and kind of what impact it's had on your life and the way that you really approach things when you got to America.
Yeah, well, I mean, we have to know that while I participated in the green card lottery, I at no point in time could I even be sure that my name would get drawn. I hoped for it all the time. I mean, trust me, whenever it was time to get that letter, I would really be very impatient and also disappointed the first 3 times where it didn't work. But it was clear to me that there was a possibility of having to do my life as a Luxembourg citizen in Luxembourg. And I chose to do so as a Luxembourg law enforcement officer. And the reason of doing that was it actually has quite a deep reason in some way. I was raised by a single parent who was exposed to certain part of society, and as a young boy, you want to be on the other side, right? And I felt like by being part of something that represents the government, I could do that. I also felt like by knowing lots of perspectives and by understanding different perspectives, I could do a good service to the community that had allowed me to, well, be raised in humble conditions by a single parent, but still be given the chance to go to a boarding school that was subsidized by organizations that would help children by single parents, and get that good education and really get everything I needed to become the person I am. So I have a big heart, I have a good sense of justice, and I see all kinds of different perspectives, and that I thought would make me probably a good officer, right? And it did turn out that all of these qualities came in very handy. And, all in all, it was still almost 10 years that I was a law enforcement officer. 2 of those years were in training, but for the rest, I really had a nice, eclectic way of performing my service. I started off in red light district as an agent in uniform, and I fought human trafficking, prostitution, drugs, and then later on I became what you would probably refer to as an FBI agent, and I conducted financial fraud investigation. And it was just so valuable as a young man to see into the highs and lows of society. I was able to see that being at rock bottom was miserable, but at the same time, being at the very top where you had excessive amounts of money, really all the money you wanted, none of that is the good balanced path. None of that makes you happy, right? And I had the opportunity to see that whether you have nothing or you have everything, there are always people who try to cheat or try to do harm, try to go a path that is not conducive to peaceful living, and that was just very valuable to learn as a young man. And those also now being a leader in business and in the free market movement, for example, a lot of the values and skills I got from that time come in so very handy. And that's how I chose to start off my young adult life in Luxembourg.
Yeah, and it's interesting because, I've heard you tell this story before, and I've heard you tell even very specific stories about interactions with people. And I believe, my own personal belief, is that your extreme gift of empathy is what has helped you in the acclimation and also in your understanding of let's jump right into it now, of the issues that we have on the healthcare side here in the United States, because you didn't have that in Luxembourg. You had a totally different system the way it was set up, and it worked pretty well in a small country like that, because that country was pretty well off and, didn't have millions and millions and millions of folks living there that it had to take care of. But when you got here, as much as everything you loved, including the education system and all the things you loved about America, there was an example of something you didn't care for too much, and that was the healthcare system, or in particular the health insurance system, and you having to believe that you had health insurance to have health care and all that. And I believe that your vision on that, this is just my thought, and I think I feel the same way about it, is that your empathy. You see what people go through. You see what they've had to deal with and say there's just got to be a better way.
Yeah, absolutely. I mean, maybe a little bit of information about what you perceive as someone who grows up and lives in a so-called single-payer system, right? Before my work in financial fraud investigation, I had, and probably I would dare to say like 98% of the rest of the nation, I had no idea how and where healthcare is provided and funded. Because the way it works is that there's essentially one big insurance company, if you will, and it's state-run, and your premiums are taken out of your monthly paycheck. In Europe, you get your paycheck monthly. And really, because of that automatism and because of that unawareness, it was interesting that people, for the most part, didn't even realize that they were paying for it.
Yeah.
Because if you live in a country like that, where also there is less choice, right? You don't have to worry about, well, do I pay into health insurance or not? Do I pay into a retirement fund or not? That is, none of that is optional in Luxembourg. They just make you do it. And there's, of course, good and bad sides to it.
Right.
But you essentially look at your net outcome that you have in your bank account at the end of the month, and that's it. But when I started investigating financial fraud, a lot of the fraud was actually linked to taking advantage of a very socialistically minded system, right? Things such as, well, if I don't live in Luxembourg, but maybe I can act as if I lived in Luxembourg, and I know that there's a lot of help for new parents, or I know that you can literally not lose your job when you have a job and then you get very sick. So you can set up a lot of systems to cheat and to take advantage of that and suck out the money out of the system. And we know the general population has to pay for it. Someone has to pay for it. And that is the case here as well. So everybody tells you, mainly the United States, wrongfully so, especially Texas, is mostly known for, well, health insurance is bad and it's expensive and you all have guns, right? That's what everybody thinks when you leave, right? So most people will tell you, though, well, how can you leave a system like that, right? And I did have my first experiences in the United States, even when I had the student insurance policy at Miami University. You know, I have to admit, you know, those are initial experiences that leave you really thinking, well, you know, is this really a good solution? How we handle it?
Is this the best it can be, right?
Yeah. No. So I mean, I remember as a student, I had some back pain, and there's a student health center at most universities, probably have one, but they have limited possibilities there. So the moment they need an X-ray or they need the opinion of a specialist, you're off to the hospital. And the small university town that it was, there was just one hospital, meaning there was no competition, you know,
Right.
meaning they could charge
Whatever
they wanted for that X-ray. And I think I spent, I don't know, maybe an hour in the hospital, and I walked out with a bill of $5,000-$6,000, which was not covered by my student insurance, and I just was. I couldn't believe it, because that's something that could not happen to you in Luxembourg.
Yeah, that's what an eye-opener, right?
Yeah.
Here's all these great things about America, and then you just found, well, here's the loophole,
Yeah.
right? So to get all these things, you also got to deal with this. But what have you learned since then? What have you learned? Why are you part of the Free Market Medical Association? Why are you part of that movement?
Yeah, well, I learned that there is such a thing as American ingenuity, and there is such a thing as Americans who love freedom and who love agency and who love solving problems, right? And when it comes to the medical field, and that includes physicians, pharmacists, health insurance advisors, all sorts of vendors of medical devices, they are really a group of people who want to make a difference by applying free market principles to this problem, right? And they have to navigate the landscape in a delicate way because there's all kinds of legislations and all kinds of government rules that interfere with their willingness that is really mostly grounded in entrepreneurship and the wish to help people, right? But they are out there, and there's a strong movement in the United States. There's a strong movement here in San Antonio, and I'm actually a co-leader of that movement called, again, the San Antonio Free Market Medical Association. And yeah, it's just wonderful to be part of it, and I feel like we really provide a solution to a problem that this state and this country has to deal with.
I agree with you 100%. It is time for our last break for the day. When we come back, we're going to dig a little bit more into not just the problem, but the solution. Harlan Pickett, Health and Wealth Power Hour. We'll be right back. And we are back. Harlan Pickett, Health and Wealth Power Hour. Thank you for joining us today. Appreciate everyone taking time out of their Thursday afternoon. We are with Mr. Shankar Ponsalé, the CEO of ShankX Web Development and Consulting. He's been telling us about his awesome American dream, his journey from Luxembourg to the great state of Texas and all the stops there in between. Shankar is also very, very all in on the free market change to healthcare, because what has happened in this country is everything is controlled by insurance, or more particularly actually by Medicare. Now, what does Medicare have to do with anything? Well, all pricing is pretty much set by Medicare, and then you get to determine, well, how many times Medicare is it going to be? Is it going to be 5 times Medicare, 10 times Medicare, 12 times Medicare pricing? What is that going to be? What's that going to look like? So insurance companies really do take that kind of as the base. But unfortunately, that is not where it stays. It is raised up dramatically, and historically, we have not got to know what that number was. We didn't even have a reference point of knowing where that was because everything was behind the curtain. If they moved that curtain at all, it was smoke and mirrors now because you weren't sure. Yeah, I see something here, but I don't know if that's the fact or not. They just would not give you that information. And we know there's been a big push, even in the government, towards more transparency. Mm-hmm. And that has had some minimal impact, but whether you know that transparency is there or not, it still hasn't helped you in what you have to pay, because the insurance company still gets to decide what that is. Now, the good news is because of the No Surprises Act, we're not going to have as much balanced billing and some of the other things that we had in the past. And so that's all part of the solution. But in my opinion, and I believe you'll agree with me here, Shankar, the biggest thing that can make the change is individuals themselves demanding price transparency and demanding that cash be the king that it really is. Because too many places still say, oh, you're not in the network, then we're not going to even see you at all. Well, wait a minute. Why not? I've got cash to pay for this. And they still are on that insurance company, and they're just not going to let you do business with them otherwise. And that's a shame, because until we truly have a free market, then the prices are going to continue to skyrocket like they have been.
Mm-hmm. Yeah. Well, it's interesting. I I came into this field of free market medicine and advocating for it as a layman. And I think in many ways I still am, and that's okay, because my role is to help the general public understand in simple terms what's going on. And it's really interesting that it is so hard to understand it, and it is by design hard to understand it, because nobody wants you to understand it, because you can make a lot of money with people being confused. Well, let me go straight to how I discovered this. So I was a freelancer back then. I think I had a marketplace insurance, probably paid about $500 a month for something I rarely used as a healthy young individual. And but it was a lot of money. It hurt to see that go every month. And I attended a mixer, and I saw a Dr. Roger Mochigemba, who is the co-leader of the San Antonio Free Market Medical Association with me here in San Antonio. And he spoke of a medical membership for anyone who wants to have it. And the way it would work is you would pay a monthly fee, a membership fee. Back then it was $59 a month for me as an individual. And then each time I would need to see him, he only charges a $10 fee. And anything that he could take care of in his clinic would be covered by that.
And that was a lot of things, by the way.
Yeah. Oh, yeah.
That's one of the things that struck me right away whenever I saw they took care of a lot of things. Still do.
Yeah, they say 80% of a normal person's need is typically covered. And I was just so interested in that, and I actually became the second member of his clinic here in San Antonio, because I just jumped straight into it. And after understanding more, I have to say, I run a healthcare marketing agency, and I started promoting the concept of what he does, which is direct primary care, short DPC. I started promoting that, became quite knowledgeable in it, and I also started learning that a lot of, actually the majority of people in the United States get their health solutions from their employer.
Right.
And so of course there is an entrepreneurial spirit within that free market movement that made people, physicians, or health benefits advisors realize, well, we gotta provide packages for employers as well. Now, the limitation that sometimes has come up is, well, what if you need something on top of what that physician or maybe that group of doctors can offer, right? And that is where important people such as yourself came up with, again, American ingenuity and the entrepreneurial spirit, and offered complementary products that would act as a safety net to what you already have with your free market solution. And I am proud to say that I have decided to offer the Eagle Care health plan to my company. I have it myself, and I have it and pay it for all of my employees.
Yeah, and we're very appreciative of that. And you're right. What it does, in your case, we designed it to complement the Direct Med primary care, Dr. Rogers' clinic. We designed it to complement that because all of your employees also have a membership to Direct Med.
Absolutely. They have that. It's a relatively low investment as an employer that has a huge impact. It makes your workforce feel secure. They know that whenever something comes up, they can go and pay a low fee and be helped. Right? And I, as an employer, I know that whenever something comes up, there is quick help, and I can have my employee back working for me as quickly as possible, which is of course very important.
It is. And one of the other things, of course, that clinic does, and we've seen the huge growth of this, is they also do virtual care. Whether it's telemedicine or virtual care. Dr. Roger does that too. And that's a big deal because a lot of your folks don't always come in every single day now. They work from home and remotely. And, you know, all of a sudden they found out just 2 or 3 days ago they might have been exposed to someone with COVID. Well, now they're playing the waiting game, right? Well, what do I do? Well, even while they're waiting, they can still talk to somebody at the clinic and get some advice and what to look for. And those things are just invaluable to folks.
Oh, yeah. And with someone like Dr. Roger, who is an expert in telemedicine, you'd be surprised how much you can actually do. Doctors like him are trained in knowing where is the boundary of what I can do with telemedicine, and they can do quite a lot. And with him, for example, if you use the HIPAA compliant app, you don't even pay that $10 fee.
Right.
And you know the thing is, it works for everyone. It works for him as a businessman. It works for me as a business owner, and it works for my team as happy people who have access to healthcare. And access is a big topic, of course, in the free market movement, because as you know very well, Harlan, as the fact that you have an insurance card that means that you have insurance, but it doesn't mean that you have access to high quality care.
That's exactly right. Not only that, sometimes all you look at is on that card, it says deductible, $8,700.
Yeah.
I think I'll just sit this one out.
Exactly.
I think I'll just see if I feel better here soon. Well, you know, we're in San Antonio. You live here. I live here. Dr. Rogers' clinic is here. But Eagle Care is everywhere. Eagle Care is on all 50 states and in Puerto Rico and in D.C. And so if someone wanted to have direct primary care and you're listening to this and you think, man, that'd be great, but I don't live there, well, we have direct primary care access all the way across the country. So we have plans that have that as part of it all the way across. So reach out to us if you would like more information about that. And that is something that you think would fit good for your employees too, because we can certainly help you. Remember, 72727, text Eagle Care 72727. Shankar, I sure appreciate you taking the time to be on with us today, buddy. I loved hearing your story. I love hearing it every single time. I've heard it a few times now. I love hearing it every single time. You are a wonderful American, because you are an American now.
Yes.
And you're a wonderful American. You're a wonderful example of the American dream. And you and I together, we're going to fight that good fight and get it done. Take care, brother.
You too. Thank you. It's been a pleasure. Thank you so much.
All right. Health and Wealth Power Hour. See you next week. We are out.